And we are live. It's Dr. J in the house today. We're going to be talking about regrowing cartilage. Can you regrow cartilage naturally? I get this expression all the time. Oh, well, it's bone on bone, and you're going to need a hip replacement or a knee replacement. Is this true? What are my thoughts on it? So I'm going to dive in today. We're going to go through all of the aspects of this. And again, if you enjoy the content, give me a thumbs up, give me a share with family and friends. So first off, we have cartilage at the end of all your joints, right? So you're going to see it at your knee joint where you have the femur and the tibia. They articulate like this. And that cartilage is going to be that soft kind of padding at the end of the joint. And it provides a buffer. We also have, and that allows the joint to articulate and move smoothly. And the idea is when that cartilage starts to get worn down, now you start to get bone on bone. And there's nerves around there, and that can sense a lot of that irritation. There is truth to that. Now, the question is that cartilage is living, breathing tissue. It's a living, breathing matrix. And we're chronically in this state of building up, breaking down, building up, breaking down. Our body's always trying to meet homeostasis. And of course, as we age, it does become a little bit harder to build back up, right? Anyone that's gone from their 20-year-old self to their 30-year-old self to their 40-year-old self worked hard. They know the next day they don't quite bounce back, right? So there's this anabolic, catabolic balance. Anabolic is building up. Catabolic is breaking down. And you start to, as every decade you go, that catabolic, that ability to break down starts to exceed that ability to build up that anabolic balance in the short run, right? Now, the healthier you are and the better your habits are, and the more you can favor that balance. But everyone knows over time, you are still going to have a harder time getting that anabolic tissue rebalance to occur so you get back to balance, right? So the goal is that we are building up at least equal to our breakdown so we're not in this accelerated aging path. So I created a blog post. I'm going to kind of use it as my reference point. It'll be up on the site at justinhealth.com/blog or podcast, and you'll see it there. But we're going to go into the big things about bone on bone. Is bone on bone real? Now, it is. Now, the question is surgery the only thing? Now, if you're decades and decades in and you have very inflammatory diet, your diet isn't great, you're not consuming a lot of the raw material building blocks, is a knee replacement, is it necessary for you? It may be, depending on how long this has been going on for, right? And it also depends on how drastic you're willing to change your diet and lifestyle and use more natural therapies like stem cell or red or infrared laser or collagen or different peptides. These things can be an incredible palliative booster, but we still have to get the other underlying diet and lifestyle habits dialed in. Also, extreme exercise, extreme impact on a joint does increase the breakdown, and then it makes the buildup a little bit less. So we want to make sure that we're doing reasonable movement. And if we're in that breakdown phase, right, we want to probably decrease a lot of impact. Now, we want to have some impact on that joint. So walking, stepping, doing things, maybe some plyo squats. We want to do things that stimulate that joint because that helps recruit and stimulate that body to build back up. But we have to, one, make sure we have the rest time on the backside. Two, we want to make sure we have the sleep because sleep increases growth hormone. And three, we want to make sure we have the nutrition, right? So the big nutrients on board are going to be, of course, protein, right? Your bones are actually half protein. People think bones, they think, oh, calcium, right? But actually, protein is going to be half your bone, right? The other thing are collagen peptides, right? We don't consume collagen like we used to. We used to consume lots of soups, lots of skin on the animal, chicken skin, right, etc. We used to consume lots of knuckles. We used to have bone broths, and we don't consume these. So these are really important connective tissue building blocks that provide the raw material to help your body heal. So I'm going to go through a couple things. So first off, we talk about x-rays. X-rays can be helpful, but honestly, x-rays also can tell us a lot of information that may not be functionally true. So they took studies where they took people's x-rays of their spine and they looked at joint issues. They looked at DJD and they looked at disc issues. And they found half the people that had disc issues on an x-ray had no symptoms. So it was flip a coin. Okay, yeah, we see this thing on the x-ray. It symbolizes that you may have this issue, this disc problem, but flip a coin, half had symptoms, half didn't, right? So there's more to the story, right? The story is raw material. The story is, do we have other muscles working, right? Posture, sleep. So there's a lot more to the story, meaning you can have structural things on an x-ray or an MRI that may look like an issue, but they may not in reality express with symptoms. And so that matters, right? Because in the end, what do you want? Do you want to feel good or do you want a clean x-ray? So we do want to see good structure, right? We do want to see good raw material and good posture and all that. But It may not tell the whole story. That's all it is. We're going to talk about inflammation. So the gut plays a major role when it comes to inflammation, right? So a lot of your immune system is in the guts, 80%. And so if we have chronic gut inflammation from gluten and inflammatory foods, that can significantly drive inflammation in the body. And of course, the more inflamed your gut is, that can emanate to your joints. I've seen lots of people tell me, oh, when I ate a bad meal and I had upset stomach, they felt more inflamed. Maybe their back hurt a little more the next day, their knees ached. This is a big deal. One of the most common things you'll see when people pull out gluten, one of the first complaints they'll say that improved is joint pain and achiness. So that's a real thing. Next, insulin resistance. So high levels of insulin and blood sugar can increase cartilage breakdown. So what it's doing is it's increasing oxidative damage. So the more oxidation we have, that oxidation oxidation is a loss of an electron. So when you start to sugarcoat your proteins and your vasculature and your cartilage, right? And you're coating it and you're creating oxidative damage, that oxidation, it's like rusting in your tissues. And so it can cause that tissue to prematurely age and prematurely break down. And remember, everything is all about balancing catabolic to anabolic. So the faster we break down and we don't balance it with the anabolic building back, that's where pain and symptoms happen in the long run. In the short run, you may feel a little bit sore the older you get. So you are going to have more rest. You are going to have better diet, better lifestyle. If you read the TB12 method, Tom Brady's book, because he was a great athlete into his mid 40s, he talked about as he got older, he had to train more for pliability, right? 75% pliability as he got older because of the tissue quality, making sure the tissues were pliable, make sure they were hydrated, good amino acids, good rest time, because it was all about allowing that tissue to be supple and pliable and soft like a raw beef tenderloin versus like a raw beef jerky, right? Beef jerky is stiff. It's not going to absorb and soak in force, but a nice raw beef tenderloin is like a nice soft sponge. And so the more our muscles and all the things that support that joint integrity is soft and spongy, the more that force can be dispersed through the joint in a healthy fashion, and it's not going to break down the joint tissue. So good things there. All right, so protein is really important because if we're not consuming enough protein, that's a big deal. So if we have poor digestion, low hydrochloric acid, that's also going to be a big deal. And again, a functional medicine framework, we're going to look at addressing everything. We're not going to just hyper focus on one thing. We're going to try to look at the entire big picture because we really have to address everything holistically or we're not going to get the best results. Okay, and again, there are studies looking in vivo, looking at cartilage, looking at different peptides that do show excellent improvement in joint tissue. Now, the problem with studies is studies love to isolate variables. So when someone says, does this work? It's like, well, does that thing in isolation of nothing else work? Well, of course, we're going to add in the variable, sleep's an important variable, hydration's an important variable, eating enough protein's an important variable, maybe adding in collagen at a therapeutic level, maybe adding in anti-inflammatory nutrients or herbs, or maybe using a PRP or peptides. So when we have an issue like this, we're going to be controlling at least 10 to 20 variables. And so conventional medicine, double-blind placebo-controlled studies do a terrible job at this because they're just wanting to control each variable one at a time. And in functional medicine world, we live in the synergy. We know the more things we can address together, the better results. And that's why conventional medicine doesn't like functional medicine world because it's not clean, simple, and can fit in a bag like the double-blind placebo-controlled studies like, right? They want one variable. We work in the world of dozens of variables. All right, so your joints are living, they're dynamic systems, right? And so we have to make sure they're moving good. So posture matters, movement matters. So getting 10,000 steps a day is a pretty good number to hit. It's a number that tells me that you're active throughout the day. Getting some plyometrics, having good posture, right? Your spine is going to be able to resist gravity and work with gravity the best when posture is good. So posture, important. Movement, important, all right? And of course, spinal misalignments do matter, right? In the chiropractic world, we can have things like subluxations where the joint's just not moving properly. And joints, they provide afferent input to the brain. That means feedback, sensory feedback back up. And then that good sensory feedback allows the joint to move better or us to recruit those muscles so that joint can move well. The more that joint is not moving well, we'll put poor information on the afferent pathway back up, and then the brain sends signals back down when you move in the efferent, and this is going to stimulate movement. But if we have junk information up, that creates junk information on the downside. And so chiropractic can be helpful for that. Just general mobility and movement and full body movement can be very helpful because that's providing stimulation to the brain. But if we have chronic inflammation, it's very helpful to make sure that that joint is moving, especially when there's inflammation and stuckness. And a lot of times you'll see joints create osteophytes. And those osteophytes aren't just a part of inflammation, they're your body trying to reach onto that soft tissue and trying to gain stability because that joint is not stable. And so in the chiropractic world, we'll do applied kinesiology, or I used to do when I was seeing patients like that, is we test the muscles. We test the rectus femoris, we test the tensor fasciae lata, we test the iliopsoas, we test, the glute and the hamstrings to see how that all those muscles are turning on, how they're facilitated. If we see a pattern of certain muscles off, we would try to get those muscles turned back on through chiropractic, through soft tissue or active release or myofascial release, or even like sacral occipital technique blocking. So there's a lot of things we can do to make sure those muscles are turned back on. And of course, having the patients use like a massage gun or a trigger point roller could also be very helpful. So posture does matter because posture helps our body deal with gravity optimally, right? So there's the adage of like, if you took for instance, a bowling ball and you put it in your hand. Imagine this, my charger here being a bowling ball. If you put it like this, you can resist gravity pretty easily, right? Bowling ball is 8 pounds. Go 1 inch forward. Now that 8-pound bowling ball feels like 16. Now 2 inches, 3, 4, 5. So every inch forward, the theory is that bowling ball feels 8 pounds heavier. So it goes from 8 times 1, 8 times 2, 8 times 3. And so healthy posture allows your body to be more in harmony with gravity. All right, less force. All right, so the hidden gut joint connection. So gluten is a big one. I've already mentioned earlier. So when you create inflammation in the body, gluten can drive that significantly. So it's going to drive it through gut permeability. And the more permeable your gut is, the more undigested foods, especially gluten and dairy, can get into the bloodstream and the immune system can see it. And those surface proteins on that gluten can look similar to the joint, can look similar to the cartilage. And so the more the immune system is peaked up, you could potentially have an autoimmune response. Now, you have typical joint issues like rheumatoid arthritis, and you're going to see that specific where it's going to happen on both sides of the body. It's going to happen on bilateral side of the body, right? Where typically like osteoarthritis, kind of the wear and tear arthritis, that's going to be usually unilateral. You'll see it one side or the other, right? Versus autoimmune arthritis is you're going to see it bilaterally on both sides. Now, you could still have inflammation from your body that's not at an autoimmune level. So your inflammation could still be elevated. That's increasing that catabolic breakdown. So your body's still breaking down more than it's building up. You're not at an autoimmune level where you're spitting out like a positive HLA-B27 marker on a blood test, like HLA-B27 antibody or an ANA. You're not testing positive there, but it's enough to potentially put you in that catabolic breakdown in regards to your anabolic. You're not quite building up as fast as you're breaking down. So your gut lining controls, right, your joint health, right? That's where you're going to absorb a lot of the nutrients that you're going to need to be able to break down stress, break down inflammation, and all the building blocks to build back up all of the cartilage, all of the bone, all of the connective tissue. And of course, the more gut permeable, right, the more permeable your gut is, the more elevations in zonulin, the more endotoxins seeping out of your gut into your bloodstream. These can create more inflammation. So intestinal permeability or leaky gut is a big deal. And of course, it's going to impact how you digest proteins, right? The more permeable your gut is, the more likelihood that you're not going to be able to break down proteins and they're going to slip into the bloodstream and go places they don't belong. So leaky gut, like I mentioned, can inflame the joints. I already mentioned that. I talked about the osteoarthritis, autoimmune RA, arthritic issues, right? One's more autoimmune. But again, you cannot be at an autoimmune level and still increase inflammation and still increase that breakdown. Okay, so research, published reviews, and autoimmunity reviews demonstrate that an increase in intestinal permeability is present in multiple autoimmune conditions, including RA and other inflammatory arthritises. One other study, landmark study in gut, found that patients with RA have altered gut microbiome and increased gut permeability. That's why anytime we see, and again, that's at the extreme level. What if you're in this in-between level? And that's kind of where I'm at, where there's a lot of people that have this low-grade inflammation. They're not at a level where they're going to test positive for these things on a blood test or an ANA, right? So they may not test at that level, but it's still adding to that inflammatory load. I tell patients, imagine you have a stress bucket, right? And all of your stressors go into that bucket. The bigger your bucket is, the more stressors you can handle, the more you can adapt to that stress. The smaller that bucket is, or the more balls in that bucket as they overflow, that is called maladaptation, where you're not able to adapt to that stress. And now symptoms start, right? Whether the symptoms are fatigue or joint pain, any of these things can be on our list. All right, so big things out of the gate. We're going to work on at least a paleo template out of the gate. We're going to work on kind of autoimmune diets. We're going to work on good healthy fats, good healthy proteins. These are foundational. You got to adjust the carbohydrate to what you can handle. I recommend my blood sugar, functional blood sugar tolerance guide, and we'll do a fasting, a 1 hour, 2 hour, 3 hour. We want to make sure within fasting, before you eat, you're below 100, and within 1 hour, you're below 120, and 2 hours, you're back below 100, or 3 back below 100. That's a pretty good sign that your blood sugar is not too bad. Beneficial bacteria plays a big role. That's what we're going to want to look at testing someone's gut. We're going to want to look at and see, do we have SIBO? Do we have yeast overgrowth? Do we have H. pylori? These things can really impact protein digestion and absorbing a lot of the important nutrients. Okay, optimized digestion. So if we don't have enough acid, all of the protein that we're taking in may not be absorbed and assimilated and utilized and broken down well. And we know our bones are half protein. And we know the amino acids that are needed to build up cartilage. Let's see here, proline, alpha proline. See, those are the big ones. Glycine, proline, alpha proline, glycine. These are really important amino acids that are going to be in collagen, right? And so if we don't have the ability to break them down, that can be a big deal. That's why we love to have collagen peptides, because peptides mean it's broken down, it's going to be assimilated. Our body just has to utilize it and absorb it. And so we're going to be, dialing in our HCl, but, trying to do bone broth and maybe some soups. But if we can't, we're going to be adding in collagen peptides, probably 20 to 40 grams a day. And there are studies that show really powerful benefit. I'll put them at the bottom of my blog post that we'll link up here, but there's some good studies that show an improvement in inflammation, an improvement in patients' pain symptoms, taking a therapeutic level of collagen. And again, my recommendation, that's gonna be about 20 to 40 grams of collagen peptides a day is pretty good. So like in my coffee, I'll do 20 in my coffee every day. And you can always throw it in your smoothie or your electrolyte. That's a pretty easy thing. Or if you have bone broth or a soup, you can easily add it to that. Or you can mix it in a like coconut unsweetened yogurt, which is great because it just blends in, it just thickens it up. So glycation, like I mentioned, right, this creates cross-linking of the collagen matrix. It creates oxidation and it causes that tissue to be stiff. And so the more stiff that collagen is, the more it's not going to articulate and move over one another. And also the more stiff it is, the less it's going to absorb force. And then of course, the more stiff and more inflamed it gets, you're going to get this inflammatory cytokine release, and that's going to cause more chondrocyte or cartilage cell dysfunction. And then of course, if you start looking for Tylenols and ibuprofens and NSAIDs, these medications are fine acutely, right? You got to be careful with Tylenol because it can deplete N-acetylcysteine. So if you take Tylenol, make sure you at least take NAC with it. And obviously the newer recommendations, they've been out since 2018 from Tylenol company is a no Tylenol when you're pregnant. But either way, you want to take NAC with it because Tylenol overdoses and liver failure from Tylenol, they've used NAC in an IV standpoint since the 1960s to treat Tylenol overdose. And so if you have to use it, NAC. But these type of medications, even aspirin, ibuprofen or NSAIDs, and Tylenol, if taken chronically, right? We're talking a week or more, right? The more you do it, it can impact hydration, which then impacts joint articulation, and it can impact kidney and joint healing. And so these things may be fine acutely. You fall, you get hurt, right? Acutely, it may be fine, but you really want to be careful because that's going to impact your joint tissue healing over the long run. So you're much better off utilizing things like an Epsom salt, magnesium sulfate soak, or doing things like Boswellia, right? Either liquid topical on the area or taking frankincense or Boswellia internally. Curcumin is wonderful. Rosemary is great. Taking wobenzime or some kind of a systemic-based enzyme away from food, not to impact digestion, but away from food because those enzymes can go in. They can break down inflammation. They can break down scar tissue. So we'll do like a wobenzime, which is like kind of more of a papain or bromelain type of enzyme, or a nattokinase or a serrapeptidase or a lumbrokinase can be very great to help break down inflammation. And so, of course, things like high levels of insulin, like I mentioned, the oxidative stress and the glycation, but that insulin can impact the small blood vessels, which then impacts oxygen delivery and nutrient delivery, right? The first sign of blood sugar issues or insulin resistance, we'll see it in the eyes. You'll be able to see it with these different microvascular aneurysms, right? And so, of course, the little blood vessels that go to the cartilage and to those joint tissues can be impacted if your insulin's really high. And then, of course, the more insulin resistant you are, that can impact TNF alpha and interleukin 6, and that can damage the cartilage as well. So the more insulin resistance you have, the more insulin you're making, that's going to increase that TNF alpha, and that's going to increase that interleukin 6, which then can break down that tissue even more. And of course, chronic insulin, right, that can break down more tissues, and they can put you in this more catabolic shift, right? I talked about this catabolic to anabolic. So the more insulin we have, it shifts that catabolic balance up, more catabolic than anabolic. And then, of course, mitochondrial dysfunction, right? Your cartilage cells can't produce enough energy to maintain healthy tissue. So I got a study here. A study from the Journal of Rheumatology found that patients with metabolic syndrome, that's insulin resistance and elevated blood sugar and high levels of lipids, especially triglycerides, had significant faster progression of knee osteoarthritis compared to metabolically healthy patients. That's independent of body weight. So really important. So in regards to blood sugar, right? How many carbs do you need? I recommend starting off somewhere around 50 to 100, and you can use that 50 to 100 net grams per day. And you can use my blood sugar template, like I mentioned, fasting below 100, first hour below 120, hour 2 below 100, or hour 3 below 100. And you can adjust your carbohydrates accordingly. Of course, activity and lower carbohydrates and more emphasis on good fats and proteins helps. And so different supplements we're going to use. We're going to be on top of alpha lipoic acid. We may use berberine. We may use chromium. We use magnesium, B vitamins, B1, B2, B3, B6. These are all going to be folate, B12, all really important. Especially a lot of the blood sugar medications like metformin can deplete your B vitamins. They can deplete your methylated B12 and folate. And again, like just a 5-10 minute walk after a meal can be a huge reducer of glucose. You can knock down your blood sugar 10 up to 20% according to some studies. So that's very helpful as well. All right, so let me just make sure we talked about everything. So we talked about stomach acid. We talked about protein, needing at least, I would shoot for, if you have joint issues, at least 1 gram per pound of body weight. I would choose getting 40 grams of collagen peptides a day. I would do some Epsom salt soaks, especially if your knees or your feet or certain joints are very inflamed. I would look at utilizing red light with infrared. I have a red light infrared laser, and I have a setting here for joints and ligaments. And when I play pickleball and I do a lot of work, I'm going to go put it here in my favorite setting here, and I'm going to do a combination of, I'll do inflammation here, or I'll do my joints, or I'll do ligaments and tendon. And this will oscillate between red light and infrared. And so I'll put it on a stand, and I'll have it directly over my shoulder, and I'll just let it sit for 10 minutes. But the 650 nanometer and the 850 or so are going to be very anti-inflammatory, and they're going to stimulate the mitochondria, stimulate blood flow, and really help with healing. Okay, I think we had all the big stuff. We talked about other supplements we can add in. Higher dose omega-3s can be very helpful too. They can be very anti-inflammatory, reducing. And just be careful. If you're using the pharmaceutical-based pain meds, again, in the short term, it's fine. Just do extra NAC. Make sure you're hydrated. Make sure you do electrolytes. But if you need it in the chronic long term, you much rather add in some of these supplements I'm mentioning, all right? Because they're not going to have the side effects and not going to impair the liver and the kidneys and create dehydration. We talked about chiropractic, how the alter proprioception and the muscle imbalances, that's where ART or myofascial release or using a percussor can come in. We talked about the muscle imbalances. Applied kinesiology can be wonderful to test those muscles and make sure they're turned back on. And then, of course, making sure your nerves are working. So whether it's poor posture or disc issues, there's natural decompression things that can be helpful, whether it's getting your muscles turned back on, whether it's postural techniques, whether it's the Fisher traction device is a great traction device. I did a podcast with Dr. Fisher talking about his traction devices, whether it's for the neck or lower back. Those are great at home. So those are excellent. Of course, chiropractic can be great. Just make sure you're seeing a holistic chiropractor. They can look at the whole spine and apply all these modalities. We could even throw kinesio tape in there, K-tape in there. Even cupping can be very helpful for the myofascia. So those are all other good things as well. I'll try to go over everything here and kind of give you guys a really good take on everything. I think we laid it out pretty well. Make sure hydration is dialed in. Make sure electrolytes are dialed in. These are all really important things. Moving is great because moving helps with imbibition It pumps the spine, it pumps the joints, right? Your cartilage has no direct blood supply. So you need to move. Getting some walking, even just rebounding or being on a whole body vibration can also be very helpful. And if you're not hungry or your digestion stinks, think about using an Instapot. Think about making some soups and stews in an Instapot. Think about using extra collagen amino acids or bone broth, right? Think about all these different things that you can do to help kind of provide those raw materials there out of gates. All right, guys, I'm going to put together a nice blog post of all these things together so you kind of have more of a compendium of it all so it makes sense. And again, if you have an X-ray or MRI, it's good to get a good baseline and then see what you can do. My recommendation is start with the raw material. If you need, you can always look at, if it's more acute, you can look at using a red light or infrared laser like this is a class 3B. You can also look at a class 4 that's more potent. You'll get more joules per minute. You can also look at potentially PRP or different peptides like BPC 157 or TB 500. These are also good options if you need more specific therapy, or PRP, which is platelet-rich plasma, to provide more healing support directly to that tissue. If it's not as bad, you could do it all orally and allow it to go systemic. But if it's more specific and more acute, then you may need a therapy like that. And again, there are things where there's limitation to matter, so you may need some procedure. But I always try to say, go as conservative and less invasive as possible. You still have to do and provide all the building blocks because your body still needs the raw material when you've broken things down at a very high level. So hope that helps and makes sense. And if you need more support on this, I see patients all the time. I don't do the physical chiropractic medicine anymore. I'm more on the functional metabolic side, but I'm happy to provide consultation and guidance for that if you need that. There'll be a link down below if you want to reach out and get more support. Couple questions. My mom has chronic back pain and neck pain and hip arthritis. Can she regrow her cartilage back to how she felt for 10 to 20 years ago? Yeah, I mean, so if your mother's a chronic smoker, that's going to increase oxidation. That's going to decrease blood flow. And then if her diet's not great, so all those things are going to be playing against her. So you have to look at smoking, habits, hydration. What's her omega-3 to omega-6 ratio look like? Really having good, healthy fats and proteins. What's her blood sugar? So the more of those things she can do, the better she'll be. Now, there are palliative things that you can do that are still good, but they may not be root cause. Like the laser can be palliative, but it can also be root cause if you do it together. Or like PRP and stem cells, or even seeing a good myofascial release, or someone that does cupping or a gua sha stone can all be great. Is cadmium really a micronutrient? My biochemistry professor allowed a list. I mean, a lot of these nutrients like cadmium, aluminum, and arsenic, you can see them in the soil. They're just going to be at levels hundreds of times below the EPA, even maybe 1,000 below the EPA safe limit. Right. So they're usually going to be at a homeopathic level. So as long as you're at a homeopathic level, I'm not too worried about it being problematic. All right, guys, excellent chat today. Good live podcast. Hope you enjoyed it. Any questions, put it in the comments back below, and I'll come back and revisit and try to answer them for y'all. And we'll put a podcast up, or I should say a blog post that's in-depth of this podcast with all the references and all of the things that I mentioned, more in-depth, so you have that as a reference to look back